So I think it can be tricky. So, especially in that patient group who might be developing a pressure injury a part of the end of their life, it's not going to be a huge cost. Um, and they're not going to be experiencing that pressure injury for a long time, but the impact of that pressure injury in that moment is immense. So you have a person who's, is already either has suffering a trauma, might be have cancer, and then they have this additional painful thing that they have to deal with that also has to require it takes medical treatment, medical care. So they might like a person with cancer who's at the end of their life might not want to be moved all the time. They might find that having a full body turn is actually really painful, or it takes a lot of medication for them to be comfortable for that procedure. And so that might make them delirious, or it might make them sedated so that they're spending less time with their loved ones at the end of their life. So that's a profound impact on that person, even though they might not be experienced for a long period of time. But the impact on them and their family is huge. In terms of the patients who might have a pressure injury and then go out into the community, you're looking at a situation where we might have done a great thing and saved their life. They might have been really sick. They might have had a trauma. There may not have been any way to prevent it, or very, very difficult to prevent that injury. But now you've got this person who the rest of their life and their rehab is now affected. So, we'll often routinely say, well, if it's a sacral wound, well, you're going to need to lie side to side, or you need to be standing and walking or lying on your side. There's no sitting. There's no. So how are you going to go enjoy a meal with your friends? Comfortably watch TV. Not get a chest infection. It has this long term effect, and if you're not doing a surgical intervention for these full thickness injuries, and you can't always do that, that could be 3 months, 4 months, or longer. And we do even have patients who make a choice because of the impact on their quality of life and the other things they want to do. They sometimes choose to have a wound that doesn't progress and it's stable. And then you're looking at living with a significant open wound and all of that entails for their foreseeable future. So that's quite a profound impact. In terms of the Australian context as well, is we don't fund dressings. So once they're out of the hospital or out of an outpatients department, they would be then bearing the cost of that. And if a person's under 65, they're not eligible for, um, subsidised district nursing services and things like that either. So then they have to bear the cost of that. So I know Dr. Suzanne Capp at Melbourne Uni has done some work about the financial cost that people bear on wound care. And, she's talking about people remortgaging their houses, spending, tens of thousands of dollars, either paying for the care or paying for the products as well.
So the burden of pressure injuries is such an interesting topic because historically, pressure injuries were viewed as quality. What is the quality of the care that the patient's getting? If they developed an injury, it was typically deemed that the nursing care was poor or the patient wasn't repositioned or something like that. And so I think there's a reputation that the care facility can get if they have extensive amounts of pressure injuries. However, we know that there's all these factors that go into pressure injury development, and it's really quite expensive. So there's great literature to show that the cost of treating a hospital-acquired pressure injury can be over $43,000. And so obviously the cost is one thing. The morbidity and mortality for the patient is another thing. Pressure injuries are painful and they take a lot of nursing time. They can extend the length of stay of the hospitalization. So all of those factors go into that cost, but then it's ultimately the patient that really suffers. And I know that the nursing staff is, challenged with both preventing and treating the wounds once they develop, but if they prevent, then they shouldn't have to treat as well. So that could be a big time savings.